Hello, last video of Regis College. All right, this is my little pocket guide. I should get to the front page. This is the from before, and then I've added 8 additional cards. So my first one is on hepatitis B, because this is a big one. I am seeing I had a spot burned off the other day, along with all my other things going on. Anyway, sorry. Hepatitis B. I had to make a card out of this one because this was, it's taken a lot to get into me. So HBsAg positive is infected either acute or chronic. HBsAg negative is not infected. HBsAb positive is immune due to past infection or immunization. HBsAb negative is not immune. HBcAb positive has current or past infection. HBcAb negative is immune due to immunizations. IgM anti-Hep B or HBc positive is acute hepatitis B, and then IgM anti-HBc negative is chronic hepatitis B. And I got those from hepb.org. And then I did the DSM-5 criteria for anxiety, and excessive anxiety and worry about many events or activities occurring more days than not for at least 6 months that are out of proportion to the likelihood or impact of the feared events. And then Mr. Fisk is the mnemonic, and it stands for motor tension, restlessness, fatigue, irritability, sleep disturbances, and concentration difficulties. And then, okay, and that was from the National Institute of Health. And then the one for depression is from the National Institute of Health as well. It is the DSM-5 criteria for depression. Patients must present with at least 5 of the following, with 1 being depressed mood or loss of interest/pleasure, present most of the day, nearly every day for a minimum of 2 weeks. And that mnemonic is SIGCAPS, and it's sleep, interest, guilt or hopelessness, energy, concentration, appetite, psychomotor, or suicide. And then I did one on uterine fibroids, terminology and location. And I have a little picture. The intramural is located in the uterine wall. Submucosal is derived from myometrial cells below the endometrium and protrude into the uterine cavity. And then subserosal originate from the myometrium of the serosal surface, and they have pedunculated bases. And that's from the mayoclinic.org. And then symptoms for endometriosis. This was a good one for me because with all the different things that can go on, all the different symptoms, I was like, I need to get these all into one little concise little card. So endometriosis symptoms: dysmenorrhea, heavy or irregular bleeding, pelvic or inguinal pain, low abdominal or back pain, dyspareunia, scarring of uterosacral ligaments, nodularity of rectovaginal septum, dyschezia associated with cycles of diarrhea and constipation, bloating, nausea, and vomiting, pain with urination, urinary frequency, and then pain with exercise, and then infertility. I almost said infidelity. I'm so tired. I can't sleep because of my hip and my shoulder pain, and then studying. I've been up since 4 something. All right, headaches. All the different headaches that I feel like I missed one, but maybe not. Oh, sorry. The endometriosis symptoms were from hopkinsmedicine.org. And then headaches, primary a primary headache is the cause of the headache is the cause of the headache. And then secondary is something else causes the headache, whether it's high blood pressure, smoking, alcohol, drugs, stress, lots of different things can cause that secondary headache. And then migraines without auras are more common than with auras, which I found was interesting. A migraine without aura lasts for 4 to 72 hours. It's unilateral, pulsating, and it can be moderate or severe. And then migraines with auras, these can be visual or sensory auras, and the auras can last 5 to 60 minutes prior to the headache actually coming on. And they are also unilateral, pulsating, and moderate or severe. And then you have tension headaches, which are band-like headaches. They are mild to moderate intensity. They're non-throbbing, and they're bilateral compared to the migraines that are unilateral. And then cluster headaches, these usually occur in males. Oh, the migraines usually occur in females, sorry. The cluster headaches are usually males greater than 30 years old. They're often caused by alcohol, excessive caffeine, or nicotine. And then they're considered the suicidal headaches because they're so painful. And I got that information from the clevelandclinic.org. And then ovarian cancer staging. Stage 1, the cancer is still contained in the ovary or ovaries. Stage 2, the cancer is in one or both ovaries and has spread to the pelvis, but there's no lymph node involvement. Stage 3, one or both ovaries, and either one or both of these things has occurred also. Spread to the peritoneum, or the cancer is spread to the lymph nodes. And then stage 4, the cancer is spread to the liver, the lungs, or other organs outside the peritoneal cavity. And I got that information from cancer.org. And then my last one is endometrial cancer symptoms. Abnormal uterine bleeding occurs in 90% of all cases. I actually have 3 friends right now with endometrial cancer, and they all started out with the abnormal uterine bleeding, every single one of them. Postmenopausal bleeding, even 1 drop of blood warrants a workup, and by golly, I'm on this with my girlfriends and my sister. Amount of bleeding doesn't correlate with the risk of cancer. The probability increases with the number of years beyond menopause. And then postmenopausal bleeding, need to do an endometrial biopsy and or a transvaginal ultrasound to evaluate the endometrial lining. And then pre- and perimenopausal women with abnormal bleeding should also be worked up. And I got that from cancer.org as well. And we're back to the beginning of my trusty pocket guide. All right, thank you so much.